name is Aaron Larios Newbert, and today we'll be talking about depressive disorders and bipolar disorders. Another thing we'll be touching on is the signs and symptoms and how you can be treated. So the first one we have is major depressive disorder, and also known as MDD, but it also is called clinical depression. One of the signs and symptoms would be obviously depressed mood. Another big one though that seems to catch people's eye the most is lack of interest in things that they used to really enjoy. So like for me, I really enjoy lacrosse and I enjoy playing video games. So I mean, if you were to see me stop playing video games or stop playing lacrosse, that could be something that would be considered lack of interest in things that they enjoyed. Another one that's obvious to the eye is changes in weight, overeating, undereating, gaining extra weight, losing excessive weight. Another one would be somebody who's just tired all the time or can't find a way to sleep. Those are some of the common ones as well. But some of the ways that you can help, obviously there's antidepressants. Everybody's heard of antidepressants, and but then there's a couple other ones that have to do with electrotherapy. So the first one would be electroconvulsive therapy, ECT, and that one is electronically induced seizures. And what that does is that's just supposed to help relieve your mental disorders. Another common one that is called TMS, transcranial magnetic stimulation. And what that one does is a non-invasive form of stimulation. And what it does, it's supposed to change the magnetic field in your brain to help with these disorders. And then the last one is VNS, or vagus nerve stimulation. And that is something that is put in your chest, And what that is supposed to do is send impulses to your brain through the vagus nerve. And again, it's similar to ECT in the fact that it's supposed to send electricity through your brain to help with this disorder. The next one we have is PDD, or persistent depressive disorder. And this is one that lasts longer than 2 years, and it's a combination really of low-grade persistent depression and chronic major depression. But some of the symptoms include, not eating enough or overeating, so similar to the last one, and then sleeping too much or too little, and then lack of energy, low self-esteem, trouble concentrating. And a lot of these depressive disorders all have very similar symptoms, signs and symptoms. So I'm going to have to be repeating myself quite a bit. But another one that popped up on this one that didn't pop up on MDD was the feeling of hopelessness. So that's one. And then ways that this can be treated again are antidepressants, psychotherapy, so talking to somebody, having a therapist there to hear you out so you can get things off of your chest, off your mind. And then we have our first bipolar disorder. It's manic disorder or bipolar depression. And so what this is just somebody who experiences really high highs and really low lows, but they can't control it, and it's periodic and goes up and down very quickly. It's said that traditional antidepressants aren't recommended for this, but it also is said that no drugs are proven to actually help with bipolar disorder. I mean, they give them a placebo a lot of the times, and sometimes that helps. Some of the reasons why they don't give them an antidepressant is because if they do, it increases their highs, but they're high in the illness, not necessarily drug-related high. But it also speeds up the episodes, and by giving them more episodes of bipolar disorder. So one of the ways that it can be treated is through a mood stabilizer. It's called lithium. Um, Supposedly that is supposed to bring your mood swings under control. And then the next one we have is, this one is a little bit more common knowledge, I believe. This one is seasonal affective disorder, also known as SAD. But this is the one that happens, it fluctuates with the seasons. So the less sunlight you get, the more depressed you become. The more sunlight you get, the happier you are. So during the spring and summer, you usually aren't depressed, but during the fall and winter, you are depressed just because you aren't getting enough sunlight. But one of the ways that you can treat this is by sitting in front of a light box for between 15 and 30 minutes each day, and that has been proven to help people. So here we have the factors that can increase the risk of suicide. So because suicide is I don't want to say a consequence, but suicide is definitely a possibility with somebody who has depression and bipolar disorder, because they feel as though they don't have a way out, and this is just a way to get rid of everything at once. So increase risk factors that can result in suicide would be somebody who is socially isolated, if they've gone through criminal problems, whether that means going to jail, going to court, something like that. Financial problems, something that induces a lot of stress as well. So like financial, family, loss of job, anything like that. Like somebody who abuses drugs or alcohol as well is likely to consider suicide over somebody that doesn't. Another thing is childhood experiences, so childhood trauma, whether they were abused as a child, sexually or non-sexually, neglected as a child, bullied as a child is another common one. Even breaking up with somebody, like breaking up with your significant other, can result in suicide. In these people that have a depressive disorder or abuse drugs and alcohol as well. Somebody who has a depressive disorder or even bipolar disorder, but also has access to strong medication or a firearm, is at an increased risk to take their own life, just because the option is closer and it's there and they see it, But now we're going to talk about non-suicidal self-injury, also known as NSSI. This is just somebody who's trying to deliberately inflict pain on themselves but not commit suicide in any way. So this can range a lot, in the sense that it can just be somebody scratching themselves over and over and over again. It can be somebody who burns themselves too. It can be somebody who cuts. That's another, like a very common NSSI thing, is somebody who cuts themselves, whether it be on their arms, on their legs, anywhere. And then another form of NSSI that doesn't really, I would say, that comes to mind right away, is just not letting their wounds heal and like constantly, digging into their skin and just not letting themselves heal properly. And but some of the highest rates of NSSI are among adolescents, and that's between 12 and 24% have reported that they have self-injured before, and 6 to 8% report current and chronic self-injury. But some individuals continue to engage in these behaviors if they don't seek treatment early on, and they just find it as a way to relieve pressure, relieve pain, relieve stress, like all of the above. But if people that can get help early on are less likely to continue the behavior as they get older. So overall, depression is very real and can take a toll on very many people, whether you know it or not. Some of these were just some of the signs and symptoms that are common and obvious, but not everybody is the same. Um, there are many forms of depression, so saying that somebody doesn't have depression or telling them that they don't have depression is definitely not the way to go. Um, there are certain ways that are proven to help with depression, but not everybody is the same. Everybody reacts differently to different stimuli. But if you have had depression or know somebody that has depression, just trying to be an outlet for them, trying to just help them, invite them places, take an extra little bit of time with them, reach out to them a little bit more is all ways that we can just help our friends in general, whether they have depression or not. And then these are my sources. Overall, I did learn a lot from this presentation. It did help me understand different forms of depression a lot more. And just taking that extra little bit of time out of your day to reach out to somebody who's been sad or has been down is something that I will continue to do, just because, I don't know, I would not like to lose any of my friends to suicide or depression, just because anybody didn't reach out. This was my presentation on depression and bipolar disorders. Thank you.